The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Welcome again to another edition of Your Health, Your Choice. We've been looking at a range of diseases, communicable and non-communicable diseases on this program over the last 5 years or more. Today we want to focus on high blood pressure or hypertension. And once again, we have with us in the studio Dr. Claude Khan, community diabetologist, family practitioner. Obviously, we will go through the various, as we normally do, the stages, definitions, diagnosis, targets, the effects on our bodies. And there are a range of organs that are affected by high blood pressure. So if you're one of those people suffering from that particular disease, non-communicable disease, high blood pressure or hypertension, this is a program for you. Also, we've been looking recently at a global peace plan where the anagram peace, the C in the word peace is all about caring for the sick, and the E is about education. So we're trying to combine both of those aspects of the global initiative here on this program, Your Health, Your Choice as well. So first of all, Dr. Khan, would you like to give us a definition then of what hypertension?
So we're coming back to some of the basics of clinical medicine. We were doing things like domestic violence, child abuse, which are very important, but we decided we would come back to some of the bread and butter issues. So high blood pressure is one of the most common medical problems, and very often when I see my diabetic patients, and I'm known for diabetics, but high blood pressure and diabetes often go together. Yes. In fact, you often talk about the ABCs.
Well, I have a little thing here. Not sure if it can come up on the camera, but yeah, we normally talk about the ABCs of diabetes, and the B is blood pressure. So you check your A1C, you check your blood pressure, and you also check your cholesterol when you're diabetic. So we're focusing then on the B there.
Blood pressure. So we have done programs on high blood pressure, and today we're going to talk more about the effects of high blood pressure. But let me just define what a high blood pressure is. Now, one of the things to say is that it's asymptomatic. By that I mean you may have no symptoms at all. Right. And that's the dangerous thing about it. It's a silent disease. I don't like to use the word silent killer, but it is a silent disease that can go on for years. And basically, it's a resistance against which your heart is having to pump blood around the body against. So that's the way I explain it to patients. It's the higher the blood pressure, the greater the resistance. And remember, the heart is a pump. So the harder that pump is having to work, it means that the heart can enlarge, as we'll talk about, etc. So high blood pressure basically is a resistance against which the heart is having to try and pump blood.
So the pressure of the blood.
So the heart is working at a higher rate, and the pressure within the blood vessels itself is increased.
Right.
And we'll talk about how that damages the walls, etc.
Okay, good. Right, so we've got the definition. How do you, as you said, it's a silent killer.
Yes.
But how do you diagnose it?
You know, I often say to patients that the reason I like diabetes is that it's easy to diagnose. People come in, they do a blood test, either in the office or we send them to the lab. They do the HbA1c, which is the blood test that gives you a 3-month average. And if it's above 6.5%, if you're fasting, it's above 126. Although you might want to repeat it on more than one occasion, it's easy. High blood pressure is problematic. The reason is we have this phenomena of patients coming in to a doctor's office and the blood pressure just shoots through the roof. So they come in and the blood pressure is high, and they will tell you, Doc, my blood pressure is normal at home. And in fact, the American Hypertensive Society and American Heart Association now says that we should be taking people's home blood pressure measurements more seriously. And so the way we diagnose high blood pressure, yes, is measuring the blood pressure, but we have to be, let me just be a little bit specific here. The size of the cuff that you're using is very important. So there are different size cuffs that can be used. Some people like the machines around the wrist, but those are not as accurate as around the arm. The machine that you're using is important. The position of the arm. If you do your blood pressure with your arm like that or above the heart level, you will get abnormal readings. So your blood
at the level of your heart.
Right. So you may want to ask the patient to rest their arm on the table, relaxed, and at the level of the heart. And then you may want to do the blood pressure on the right and the left arm. In fact,
why is that?
Right. So some people think that the blood pressure is more accurate on the left arm because it's nearer the heart. But that's not the reason. It's that there are some conditions where if you have a kink in the artery, and it's a rare condition, you can have a different blood pressure in the left arm as compared to the right. So you really should do the blood pressure in both arms. So the way we diagnose high blood pressure is by measuring the blood pressure, but you should do it on about 3 occasions, either in that one visit or subsequent visits, and after the patient has been sitting in your waiting room for 10 to 15 minutes. Now, we know that a lot of patients don't like waiting, so you have an appointment for 2:30 and you expect to get into the office at 2:30. Well, unfortunately, it doesn't work like that. Medical consultations are very difficult to predict. You know, we give people in my office half-an-hour appointments, but sometimes the appointment, if somebody starts crying in your office, you can't just rush them out. You know, you have to look after them. There's one other way you can diagnose high blood pressure. It's called an 24-hour ambulatory blood pressure measurement, where you send them to a center where they put on a little machine and it measures your blood pressure every hour.
Would a Fitbit work?
The Fitbit, I am not sure. The Fitbit measures your heart rate. I'm not sure if the Fitbit as yet does the blood pressure.
Okay.
I'm not sure. But there might be some devices out there that are doing it.
Yeah.
So that's the way you diagnose high blood pressure.
Well, that's good to know that what patients can expect when they go into the doctor's office and what you regard as best practice. Okay, what about targets?
So, boy, this has been a difficult one. It's a moving target. Maybe 20 years ago, we used to talk about 120 over 80, and then slowly we said 140 over 80 or 140 over 85. But it is patient-specific. And this is, again, what I would call the art of doing medicine. One cap does not fit all. So when we hear people saying, take one drug like Omega XL, and recently, yes, I'm coming back to it.
Oh,
recently, yes, oh dear, I saw a television program. I was waiting for my daughter on my way to church on Sunday morning. After a church program, one of the pastors of these churches promoting Omega XL and claiming that Omega XL can cure you of high blood pressure, high blood sugar. That's rubbish. Absolute rubbish. I'm very outspoken. Yes, my wife is telling me calm down.
So, yeah, targets.
Linda, but do you know why I am animated? Because we see the effects of people taking these scam drugs, fake news, I call it, fake medicine, and then people end up with all the side effects that we're going to talk about. So, yes.
The average Trinidadian, though, is pretty educated, and I know that most of us realize that there is no one drug that is going to cure every single ailment in your body. So, you know, they can promote what they like, but, you know, we're intelligent enough to understand that there's no one cure-all for every single disease that we're going to
well, I do hope so. I mean, but the advertisements are very persuasive, I have to say.
They are, yes. So, I've seen some of the witness testimonies and so on. Yeah. It's patient testimonies.
Yeah. So the answer to your question, what is the target? Most people 140 over 85, but for diabetics, we are now saying back to 130 over 80.
130 over 80.
And if you have what is called microalbuminuria or protein in the urine, then your target should be probably about 120 over 80.
Okay, so that has to do with your kidneys.
Kidneys, yes. So if you have protein in the urine, your kidneys are at risk, and we want your blood pressure to be even lower.
Okay, why is that?
Because high blood, as we would show, one of the major causes for end-stage renal failure, kidney failure, is high blood pressure.
Okay.
So the lower your blood pressure within reason. Now, remember, there's what is called a J curve. If your blood pressure goes down too low to like 90/6 now, okay, so let me be careful. There are some females in particular, very slim females, that their normal blood pressure is 90/60. But
I used to be like that.
Yes, your blood. Yes, you used to worry about it, and now your blood pressure is a little bit better than that. But an elderly person, for example, if I have someone who's 80 years old and their blood pressure is 90/50, I'm concerned about that, because they can get dizziness, etc., and fall over and problems. So yes, we have 140/85, but it's a moving target depending on other comorbidities.
Okay, so it's patient-specific.
Patient-specific,
Good.
Yes.
Right, so we've looked at the definitions, we've looked at targets, we've looked at the diagnosis. What about the effects?
Right. So we're going to bring up the first slide. I think Josh is going to bring up the first slide for us. And this shows an artery. It's a very nice, clear diagram. And you will see, you might just be able to see that the artery on the walls, plaque is building up. And the blood is flowing, but the arteries are beginning to narrow.
That's the yellow bit.
The yellow bit, yes. That's plaque buildup. So we can just come off that slide. So what is happening here, before we talk about plaque buildup in itself, the higher the blood pressure, the blood vessels should be sturdy, should be smooth, and the blood should flow easily through it. What happens with high blood pressure? Remember, the higher the blood pressure, it begins to do damage to the walls of the arteries. And that then sets up a vicious cycle where you have plaque being built up easier than someone without high blood pressure.
Right.
But the other thing is that the arteries become stiff. And stiffness of the arteries is a major problem, because remember, when the heart is pumping, if the arteries are very stiff, the heart is having to work.
More pressure.
More pressure needs to be exerted. So the first damage that we're talking about is to the arteries right around the body.
Right. So we have blood coursing through every single part, every region of our body, which means that high blood pressure can affect every part of our body.
Absolutely.
If the arteries are being clogged.
Absolutely. Yes.
Okay. Right. What about the next slide?
Yeah, the second slide is something called an aneurysm. So I'm going to ask Josh to bring up this slide as well. Right. So you see here what is called an aortic aneurysm. This is one of the main arteries in the body.
In the heart.
And this is coming from the heart.
Okay.
This is one of the main vessels coming from the heart. It's the aorta, and you notice that it's bulging.
Right.
All right. So I'll just explain that now. So what happens is that with the high blood pressure, there might be a section of the wall of the artery that's weak, and because of the high pressure, it begins to bulge out. Now, this is a serious problem because it is a silent process. So you don't know that you have an aortic aneurysm that's developing very often until it ruptures.
That's when, so you feel the pain only when it ruptures. You don't feel anything before.
You may have no symptoms at all. And this is where we are coming back to what is called preventative medicine. You know, Linda, a few weeks ago, we talked about the need for colonoscopies because of, well, not because of my own experience, but I've been pushing that strongly. Women having mammograms, pap smears, men having their prostates examined. So here's another area. A lot of people do not have their blood pressures measured on a regular basis. You know, if you're in your 30s and 40s, you should have your blood pressure measured at least once a year. Because what happens is if your blood pressures are extremely high, and an aneurysm would not develop if your blood pressure is probably around 150/80 kind of thing. But if many people come in and their blood pressures are like 200/110.
So that would be an indication that some kind of clotting, clogging is happening?
Well, clogging is happening, but damage to the walls of the artery is the first thing we're talking about. So the arteries begin to bulge, and then at some critical time, you can have rupture. Now, if you have an aortic aneurysm rupture, I have to, sadly to say, the chances of survival is very low. What we want to do is pick up that aneurysm, which could be done by an ultrasound or a CT scan, and operate on it to repair that aneurysm before it ruptures. But if an aneurysm ruptures, very low survival rate. The other thing is the aortic aneurysms are not the only area where an aneurysm can be present. The other place is the brain.
Right.
And we're going to talk about strokes, but one kind of stroke is when you have a brain aneurysm that ruptures, and the mortality rate, people die
aneurysms
of aneurysms much more than the other type of stroke, which is called an ischemic stroke. So by the time you have a brain aneurysm that ruptures, that's bad news. So, you know, and that's why preventative medicine and treating high blood pressure is so extremely important.
And education.
And education. Of course, and I know you like the lifestyle bit, you know, eating healthily.
So I was wondering about the salt content in our diets and how that, nutritionally, how that would affect our blood pressure. So
salt is definitely one of the main factors that send up your blood pressure. And the problem is that, we like food that is highly seasoned, spicy, nice tasting food. And if your palate has become used to a high salt content, it's very difficult to change that as you get older.
Not only that, I think a lot of the foods and drinks that we buy contain, if you should examine the labels for the ingredients, and the content of sodium in those foods is also going to contribute to your high level of obviously to the high blood pressure.
Yes, the high blood pressure. So sodium is what you should be looking for. I think we have to go to a break.
Okay, right. So our cameraman is indicating that we need to wind up for our first break. When we come back, we'll be looking in more depth at some of the organs that are affected by high blood pressure. Don't go away.
We supply all sizes in digital outdoor and indoor signage, both sales and rentals. Be seen with huge, clean, and crisp screens from the Creation Group. Think ahead, stay ahead with the Creation Group of companies, located at 2A Arupita Avenue, Woodbrook.
Who will emerge this April exclusively on ACTN The Voice? Over 183 submissions, countless videos, but there can only be one winner. Get ready for the biggest gospel talent show, Emerge Gospel Challenge. The fun and games are over. Every Sunday, 6:30 p.m. exclusively on ACTN The Voice. ACTN The Voice. Check your local TV listing.
All right, boy. All right, Not if vigilantes run you out of San Francisco?
Like they take the cow and calf, you can sell them in Independence. The government drew a new line and we're on the wrong side, so we have to go.
I can't stand up.
You can't stand up, little buddy. You really can't stand up?
You're standing on my hand.
Red sheet wearing sand crawling. Let me.
Got me as a friend, you don't really need an enemy.
Thank you.
George, what about my coat?
Oh, it's very nice. Hey, I can use that one.
Welcome everyone to another edition of Football 101.
Half season and things are looking gloomy for Madrid.
Is a Chelsea fan.
I only know one side of Manchester and it's red. I don't know what any blue side.
Yes, I'm an Arsenal fan.
That's very unfortunate.
I love you, Messi.
Mike want to say thanks, but
no.
What are you gonna do?
We bring the feel directly to your home.
Welcome back to Your Health, Your Choice. Today we're looking at high blood pressure. We've already examined the definition, what it is, the diagnosis, targets that you want to look for in terms of a healthy blood pressure as opposed to a non-healthy one, the effects on our arteries, and what are aneurysms. We have an interesting clip that we want to share with you. Right now before we go into the next segment of the program.
Do you know if you have high blood pressure? Find out how you can prevent or control it. High blood pressure, when left untreated, can damage the blood vessels in your body. It hardens the arteries as cholesterol and calcium builds up. Over time, the arteries narrow, restricting blood flow and damaging critical organs like the heart, brain, eyes, and kidneys. The first sign of high blood pressure affecting the heart is the thickening of the heart muscle. It now struggles to pump blood into the circulatory system through narrowing arteries. Left untreated, the condition worsens, and all this time, you do not feel any symptoms. Over time, high blood pressure further narrows the arteries, cutting off blood to the heart. When your arteries become critically narrow, or if a piece of the blockage breaks off, it may result in a heart attack. A heart attack can cause permanent damage to the heart muscle by affecting its ability to pump blood, resulting in heart failure. High blood pressure is a leading cause of kidney failure. Damaged blood vessels in your kidney affect its ability to filter and clean blood. Left untreated, the kidney will eventually fail, and dialysis or a kidney transplant will be needed. In your eyes, high blood pressure can affect the tiny arteries of the retina. Bleeding and blockage can result in blurred or lost vision. When arteries harden in the brain, you can suffer a stroke that damages brain tissue. Some arteries may rupture, causing bleeding or hemorrhage. This can result in slurred speech, paralysis, and loss of consciousness. Do you know if you have high blood pressure? Find out how you can prevent or control it. Eat healthy, relax, lose weight, and take all medication given by your doctor, and you can control high blood pressure and stay healthy. Talk to your Kaiser Permanente healthcare professional today to learn more.
Welcome back again to Your Health, Your Choice. That clip was quite a clear indication of all the various organs that can be affected by high blood pressure. We're talking about the brain, we're talking about the kidneys, eyes, heart, almost every organ seems to be affected.
And there are a few more that we will mention.
Yes.
Yes.
Okay. Yeah. So let's have a look then at the you mentioned the arteries itself, and they mentioned their calcium, cholesterol content in your food.
Yes.
How does that affect?
So, one of the things is talking about calcium supplements. Mm-hmm. And there's no clear evidence with high blood pressure that your calcium levels can also be high. Mm-hmm. So the advice really now is that men should not be taking calcium supplements.
That's interesting. Yeah.
Women, because of the risk of osteoporosis after the menopause, we give Caltrate plus vitamin D. Mm-hmm. Now, some cardiologists give vitamin D supplements, vitamin D on its own. I guess there's some evidence from their perspective that it helps with cardiac function. But calcium supplementation in men is not advised. And because it can actually cause further buildup of plaque in the arteries. So I just wanted to make that point.
So that's calcium supplements. What about including calcium in a normal diet? Cheese and...
No, that's fine. That's fine. But it's when you're taking, like anything that's taken in excess is not good. And but especially with calcium, we are saying for men. Now, women, as I'm saying, because of osteoporosis risk, there is a benefit for taking calcium supplementation, I guess. But again, I guess if your diet is good and you're taking dairy products, of course now there's a lot of the alternative practitioners try to persuade people not to take milk or dairy products because of allergies, and
I think it's cow products and not necessarily. I mean, you can have goat's milk, which still contains calcium.
But it always amazes me that almost every patient who goes into the alternative practitioners are told that they have dairy allergies. That's quite amazing, actually. I don't know how they make that diagnosis. So let's go on to the other one, in the coronary artery.
Coronary artery disease, yes. So explain that.
So we have slide 3. Slide 3. So this is a nice slide. This is an angiogram that was done. A dye being placed into the body, and it shows up the arteries. And you can see that there's a narrowing of one area. And so that's a blockage. That's what we call a blockage. Now, if there's one area, it can be probably a stent can be placed there. But if there are multiple blockages, that patient may need bypass surgery. So we can come off that slide. Again, what does this have to do with high blood pressure? Remember, we are saying high blood pressure damages the walls of the arteries, makes it more rigid, and then because of the damage, plaque buildup is easier to form. That's cholesterol plaque. And I know, surprisingly, there are still some people out there still denying that cholesterol has anything to do with heart disease. I think the evidence is so strong that cholesterol does contribute to heart disease. And since we have started treating cholesterol aggressively, the evidence is clear that the rates of heart attacks, etc., has dropped. So, you see that area, that narrowing. But again, I mean, the patient may not have any symptoms. That's why what I do with my patients now is, especially diabetic patients, we do a cardiac risk calculation. Our smartphones are wonderful devices most times, although I saw a report just this week about cancer
of the brain,
and phones. Well, I'm not going to go into that. But on my phone, I have what is called a cardiac risk calculator from the American Heart Association. I can put in the patient's age, their blood pressure, systolic, diastolic, cholesterol, and it comes up with a 10-year risk of heart disease. And so what I'm saying to patients is, putting you on aspirin and putting you on a cholesterol tablet is not guesswork. This is science we are talking about. Like, I'm showing you that you have
all the risk factors.
Right, and you have maybe a 13% risk of a heart event over the next 10 years. And if it's above 7.5%, we say that patient should have treatment.
I remember one of the warnings on the clip was that you should keep taking your medication. I know a lot of people, when they find that the blood pressure has got to a normal level, they stop taking it. What are the effects on the body if that happens?
That's a major struggle we have as doctors, to convince patients that they need to stay on their medication. You see, Linda, the problem here is that at the best, people may be able to do their blood pressure once a day or twice a day. If we had more access to these 24-hour ambulatory blood pressure measurements, people may be quite surprised at how their blood pressure fluctuates. Again, there's this concept that your blood pressure remains at one level all day. That's not true. If you are in a traffic jam, or if somebody gives you a bad drive, your blood pressure shoots up. Now, somebody without high blood pressure, that pressure may come back down fairly quickly. But someone with high blood pressure, you may get up in the morning and your blood pressure is relatively good, but during the day, if you're under stress, you know, anxiety, things like that, and we live in a high-stress society.
We do.
Your blood pressure goes up. So you know, we need to remind patients that unless when we put you on medication, the blood pressure is dropping too low, then ring us back. You know, I mean, I make it a habit of giving patients my telephone number, and you know, I have to tell you that, you know, a lot of people are afraid to give out their telephone numbers. I don't find my patients abuse my telephone number at all. In fact, WhatsApp is a great way, and most patients, even fairly elderly patients, their daughters or sons or grandchildren have WhatsApp. They will send me messages, and at my convenience, I can respond to them.
Yeah.
Yes.
And then they have something concrete that they, instead of just, you know, when you hear something, you often forget. You've got something there visually that can remind you of what the procedure should be.
Yes, yes.
That's good. Okay, heart attacks.
Right. So again, we're going to bring up this slide, slide 4, I think it is, yes. So we see a man clutching his chest, the typical image we have of heart attacks. But unfortunately, heart attacks can be silent. So I just want to come off that and explain what we'd expect. So the typical symptoms of a heart attack is crushing, central chest pain or heaviness on the chest, pain shooting down the left arm or up the neck. Those are the textbook descriptions. Unfortunately, there are other groups of patients that may have no symptoms at all, and they go into their doctor for a routine check. They have an ECG, and they're told, oh, you've had a heart attack some time ago, and they're shocked because they never had any symptoms, especially diabetics. Now, why?
Yeah, explain that.
Right. Because there's something called diabetic neuropathy, autonomic neuropathy, as well as neuropathy. The nerve ends, people typically think that it's only the nerve ends to the feet are affected in diabetes, or the hands, but your nerve ends all over the body can be affected. So the pain sensation is blunted.
Right.
So you don't sense your heart muscle. Remember, what is a heart attack? The blood vessel is blocked, so the heart muscle is being starved of blood, of oxygenated blood, and that heart muscle begins to die. So you should have pain. Pain is a gift from God, I call it. I know a lot of people may find that surprising, but if you put your hand in fire, the pain sensation tells you to take your hand out. People with leprosy,
sign that something is wrong.
Right. With leprosy, people lose the sensation, and they may get burnt. So the typical sensation, yes, is crushing central chest pain, but very often it could be asymptomatic. That's why now we need to be selective in saying to some of our patients, you have no symptoms, but if you have been a smoker,
the risk factors are there.
Right. If you have a family history of early heart attacks, if you have diabetes, if you have high cholesterol, high blood pressure, those are 5 risk factors, you probably should have a stress test. That's where you go on a treadmill and you exercise, and that can bring out hidden coronary artery disease.
So those, when you go on those exercise machines, you get this beats per minute.
Yes.
How is that connected to high blood pressure?
Right.
Pressure?
So your pulse rate or heart rate is not directly linked actually to your blood pressure. Heart rate is now an independent risk factor for heart disease. So this is interesting because the cardiologists will tell you they want your heart rate to be about 60 to 70. Now, when you exercise, it is expected that your heart rate will go up. And when you go on the the treadmill, there's something called your target heart rate. So if you're exercising at home and you're 50 years old, and your maximal heart rate on the exercise condition should be 100 plus your age. So your target should be about 150. So if you're exercising and your heart rate is going up to 180, 190, that's too high.
What about if it's too low?
If
it's under.
Right. So if your resting heart rate is below 50 consistently, you may have what is called a heart block, a rhythm disturbance of the heart. And we have now cardiologists who specialize in electrophysiology, and they specialize in the electrical conduction mechanism, and they can do special tests. And if you have what is called a first degree, second degree, or third degree heart block, you may need a pacemaker. Okay. And we know relatives of ours who have had pacemakers.
Okay, so we're looking at the heart and what is peripheral artery disease? Right.
So I just, again, going to show a clip, another clip of, yeah, so we see someone, elderly person sitting, and she's holding her leg. Mm-hmm. You can see she has her gym shoes on, so very good. She's exercising, mm-hmm. Like we all should be doing, mm-hmm. and I plan to start back. I know you have been exercising. Linda, congratulations.
Trying.
Yes. Mm-hmm. Now, so what is peripheral vascular disease? So again, the arteries are being bombarded by the high blood pressure, the walls are being damaged, plaque is building up, and you have blockage of the arteries going to the leg. And what you have typically is what is called intermittent claudication. Big name, first simply saying you start walking, especially if you're walking up a hill or you're walking up the steps, and you get pain in the calf.
Right.
Very typical. It's like an aching pain in the calf. Now, some people may think it's muscular, but if you have pain in the calf and you rest, the pain goes away, and then you start back walking, you're okay for a while, and that's why it's called intermittent claudication. So it comes back.
After you've come.
Yeah. The problem with peripheral vascular disease is not just the walking, but if you have it combined with diabetes, then if you have an ulcer, diabetic foot ulcer, people with peripheral vascular disease and diabetic neuropathy have a very bad outcome, because then oxygenated blood can't get to the foot to heal those foot ulcers.
Right, so that's worst case scenario. We're going to our second break now. When we come back, we'll be looking at a few more of the organs that are affected by high blood pressure. We'll return in a few minutes.
We supply all sizes in digital outdoor and indoor signage, both sales and rentals. Be seen with huge, clean, and crisp screens from the Creation Group. Think ahead, stay ahead with the Creation Group of companies, located at 2A Arupita Avenue, Woodbrook.
Who will emerge this April exclusively on ACTN? The Voice. Over 183 submissions, countless videos, but there can only be one winner. Get ready for the biggest gospel talent show, Merge Gospel Challenge. The fun and games are over. Every Sunday, 6:30 p.m. exclusively on ACTN The Voice. ACTN The Voice. Check your local TV listing.
Boy. All right, might have vigilantes run you out of San Francisco?
Like to take the cow and calf, you can sell them in Independence. The government drew a new line and we're on the wrong side, so we have to go.
I can't stand up.
You can't stand up, little buddy. You really can't stand up?
You're standing on my hand.
Bed sheet wearing sandcrawler. Let me.
Got me as a friend, you don't really need an enemy.
Thank you.
George, what about my coat?
Oh, it's very nice. Hey, I can use that one.
Welcome everyone to another edition of Football 101.
Half season and things are looking gloomy for Madrid.
Is a Chelsea fan.
I only know one side of Manchester and it's red. I don't know about any blue side.
Yes, I'm an Arsenal fan.
That's very unfortunate.
I love you, Messi.
Mike, want to say thanks for...
No! What are you gonna do?
We bring the feel directly to your home.
Welcome back. We've been examining high blood pressure this evening on Your Health, Your Choice. we've looked at some of the organs that are affected by high blood pressure, and I know there's one more. You want to look at the brain? Is that strokes? Or?
Well, before we were going to look at the heart, a picture of the heart, right. Slide 6, heart failure. Okay. So slide 6 and slide. So that's slide 6. We could show slide 7 at the same time. The very next slide. You could see on the chest X-ray. That's an image of the heart. And there's a measurement you can do that shows that heart is enlarged. Of course, the best way to do it is an echocardiogram. So we can just come off that slide. So what is heart failure? Heart failure is when the heart has been damaged. You may have had a heart attack, the heart muscle is damaged, and now the heart is not able to pump effectively. So you have backup of blood into the lungs, and that's where you have what is called fluid
in the lungs.
And the reason is that the heart is not pumping out blood because of the muscles are not working well.
Right.
And so the enlarged heart usually precedes heart failure. And the way to diagnose that is not so much on the chest X-ray, but it's doing an echocardiogram, which is a simple, I call it an ultrasound of the heart. And you're able to look at what is called the ejection fraction. That is the amount of blood that comes into the heart that is then pumped out in each cycle.
How easily available are those tests?
Echocardiograms are very easily available.
And how expensive are they?
So it's available in the hospital. I'm not sure what the waiting time is like. Stress testing is available in the hospital. Again, a lot of people have to wait a while, so I say, a stress test might be about $900. An echocardiogram, I think it's about $600 or $700 an echocardiogram, roughly.
For some people, that's a week's salary, or?
Yeah, I mean, it's still expensive, but if you can afford it, it then cuts out a lot of waiting time. You see, I think what we have to accept is that the hospital cannot do all these tests in a timely fashion. And if you, for example, if you're waiting in the heart clinic for a stress test, the stress test is the first test before you can decide if you need an angiogram. The angiogram is a definitive test. Yeah. The angiogram is about 12 or 13,000, so that's expensive. But if you can do the stress test, you cut off maybe a year's waiting or half a year's waiting, and then you can take back that stress test to your government doctor, and then they can probably put you on the waiting list.
Urgent
waiting list. Yes.
Okay.
Yes.
Okay, so that's the heart. We want to focus now on some of the other organs.
The brain.
Let's look at the brain.
Right. So we're going to show slide 8. Slide 8. And what this is showing is drooping of the face. It's if you notice the right side, or I guess it's if you're looking at this, it's the left side on the screen. It's drooping slightly, and the muscles are weakened on that side. So I just want to come off that slide. So again, what happens with a stroke? The arteries going to the brain gets stiffened, plaque buildup, the carotid arteries, and then the small arteries in the brain can get affected. And as a result of that, the blood supply to certain key areas. So that's why a stroke can affect different parts of the body. You can have drooping of the face. You can have
parts of the brain as well.
Different parts of the brain. Yeah. Yes, different parts of the brain. But remember, the brain, you have the speech area. So you may have some people with a stroke, no weakness in the arms or legs, but they have a dysphasia. It could be a motor dysphasia where they can't find the words. They can think of the words, but they can't find it. It could be a sensory dysphasia where they can't understand. They can speak, and the language just doesn't make any sense. Or you can have weakness in the arms. Remember, if the right side of the brain is affected, it's the left side of the body that will have the weakness, and vice versa. Okay. So you can have a right or left hemiplegia.
That's bleeding in the brain.
Bleeding in the brain. Now, we've had a very fatalistic view of treating strokes, but actually there are now very aggressive ways. So if your family member starts having drooping of the face or speech problems, don't just sit at home. try and get them, ring 911, and get them to the hospital as quickly as possible, because they are like heart clot-busting drugs. Those same drugs can be used
for the brain.
For the brain. But what has to be sure is that it's a stroke due to a clot and not due to an aneurysm, because an aneurysm is bleeding. So if you give one of these drugs, you cause that problem to be worse.
Okay. Right. Okay. So enlarged heart,
yes, we finished the stroke.
Dementia.
Right. So dementia. I wouldn't show the diagram for this, but so dementia it can be caused. When we talk about dementia, immediately people think Alzheimer's, but Alzheimer's is only one form of dementia.
Right.
And it's due to amyloid, a substance called amyloid deposits in the brain. When we talk about high blood pressure, we talk about vascular dementia, right? So it's the blood vessels that are affected to the areas of the body that has to do with memory, the way the brain works, and it may affect how you think, how you feel, how you remember things. And remember, with dementia, it's very often the short-term memory that's affected. So you may ask someone with dementia, you know, how many kids do you have, or where do you live? And they'll answer. You ask them, what did they have for breakfast this morning? And they can't remember. Or what did they do yesterday?
Or what is the date?
Or what is the date?
I can't remember the dates often.
Yeah, but you're not suffering. In fact, your brain is excellent. Excellent condition. Very good condition.
What are these amyloids you mentioned?
It's a protein. It's a protein that, in fact, very interestingly, there's now a link between diabetes and dementia, because the same amyloid deposits in the beta cell that can contribute to diabetes, and now there are drugs being developed in the future that is trying to deal with the amyloid deposits in the beta cell. That those same amyloid deposits as a protein are being seen in the brain in Alzheimer's.
Okay, interesting. All right, can we move on then to the kidneys?
Yes, and we can bring up slide 10. Slide 10, it shows the kidney, and this is one of the big problems that I wanted to touch before we ended, kidney failure with diabetes. So high blood pressure, we can come off that slide. I think we have about 10 more minutes. Yeah. High blood pressure is the second leading cause of kidney failure. Second, diabetes. Well, high blood pressure and diabetes often go together. And what happens is that the blood vessels leading to the kidneys are affected. Again, it could be plaque buildup, etc. And the kidneys are damaged. The nephrons, which is the unit that excretes the urine, is affected. And you have slowing down of the excretion of waste products. Now, kidney failure starts at an early stage, and you have stage 1 to 5, and not until you get to stage 3, which is something called a glomerular filtration rate below 50, then we start getting a little concerned. When you get below 30, more concern at stage 4, and when you get down to 15, that's stage 5 or end-stage renal failure. Now, that could take years.
When can you get a transplant? At which stage do they recommend a kidney transplant? Because I know that we do those here.
Well, it is done here, but it's very limited. The access is very limited. I think kidney transplants are reserved more for younger patients. When I say young, maybe 50 or so or below. And remember, it depends on the cause of the kidney failure, and you have to have someone who is still in Trinidad. We're not very good at donating our organs. There are not very many people walking around.
We can exist with one kidney, can't we?
Absolutely,
right. Absolutely.
So that's one thing for family members to remember, that very often it's a family member who has to donate the kidney because there has to be a match. Yes, kidney transplants are available, but very often people go abroad to get it because I think there's a long waiting list.
I know that there's a crime level associated with these organs as well.
Yes, there's been a big thing about that in India and Pakistan and some of the other countries where People are paid for their kidneys, which should not be done.
Yes, unethical.
Yes.
Okay. What about the eyes?
So this is something that people don't realize. I'm going to show a slide here that shows, this is slide 11, and it shows someone with hypertensive damage to the eyes. You can see that the vision is very blurred, and simply, again, what has happened is that, so we can just come off that slide, the blood flow to the retina has slowed down, and areas of the retina begin to die, and you have diabetic retinopathy, which we talk about a lot, but people they forget that there's something called hypertensive retinopathy, where you can either have infarcts, just as how you get an infarct of the heart, you can, that means dying of the heart muscle. You can have dying of areas of the retina, which is then very difficult to retrieve, or you can have, again, an aneurysm and a bleed in the eye due to the high blood pressure. And again, that's why eyes need to be checked every 2 years, both for diabetics and hypertensives. And if the blood, in fact, if you have bleeding at the back of your eyes, your blood pressure control becomes more important than the blood sugar.
Okay.
Hypertension is extremely important to preserve your eyes.
Okay. So we're going to be using our blood pressure medication more regularly because we realize how many of these organs are affected by it. What about bone loss?
Yes, osteoporosis. So what we didn't realize is that people with high blood pressure have more calcium excreted in the urine, and this can lead to osteoporosis. Now, remember, but I did say earlier that men need to be very careful, or I don't recommend calcium supplementation in men. But in women, if you have high blood pressure, it can affect your bones, thinning of the bones. And remember, again, I mean, this is a silent process. People confuse osteoporosis with osteoarthritis. They're two completely different conditions. Osteoarthritis is inflammation. Osteoporosis is thinning of the bones. And very often, not until somebody has a fall, and there's minimal trauma, fracture of the wrist, or fracture of the bone in the vertebral column, then we do a bone scan and we see osteoporosis. So
your bones are nourished by blood vessels?
By blood vessels, yes.
Okay.
And by calcium. So if your calcium is being excreted, then calcium supplementation in women is very important. And of course, there are now drugs that we can put people on, apart from Caltrate and vitamin D. There are things like Bonviva, Fosamax, etc., that can be used to strengthen the bones.
Okay, so I'm a high blood pressure patient, let's just say. My medication will include cholesterol reduction, sodium reduction, calcium increase. How many types of medication am I going to be on?
Well, you know, the reality is that we are human beings, and I don't want to wax philosophical at this point because I've not put on my pastor's hat. I don't know how many more minutes. We only have 4 more minutes, so I'll have to put on my pastor's hat in a minute. But our humanity plagues us. And I think the difficulty many people have to accepting is that we get older. And as we get older, we have to expect our bodies are not going to be what it would have been like at 21. I mean, I would have loved my body to be what it was like at 21. It was great, wasn't it?
It was, yeah.
Right. Right. Yes. So let's move on quickly from that.
Embarrassing the cameraman.
Right. So we're in a Christian station. So at my age now, yes, I think back, and I have to accept that, I've lost some hair, whatever. So the point I'm making quickly, Linda, is that unfortunately, as we get older, the reality is that we have multi-pharmacy. We have to take sometimes tablets for diabetes, high blood pressure, heart, and I have patients coming in with 10, 15 different tablets. Yeah. Is there another option? No, I don't think so.
Okay. All right, so we're winding up now. We have the last 3 minutes, and we'll ask Dr. Khan to put on his pastor's cap. So, Reverend Dr. Claude Khan, what do you have to tell us today?
So I just want to remind you of the telephone numbers to ring, 482-4269, if you have what we have talked about today. I also want to make a plug, because my wife doesn't often do this, for something called the English Speaking Board program. It's a program that she runs. The numbers are 482-4269 and 350-6200. And this is helping you to do public presentations, etc. We have just completed a major outreach in the Kokay area last week, Saturday, where we had, we really connected with the community, and we were able to start something called a peace plan. I think people were surprised when they came in, because they took out their money to pay for drinks and for food, and everything was completely free. Why are we doing this? We believe that our faith communities are instrumental in promoting reconciliation, in promoting peace within our communities. We don't believe that our faith communities should be within the four walls of a building. We need to mobilize ourselves. And notice I said faith communities. We are Christians, we are pastors as well. And so we're coming from a Christian perspective. But I believe whatever faith community you're in, you need to mobilize yourself. So the peace plan talks about planting faith communities, equipping servant leaders, caring for the sick, assisting the poor, and educating the next generation. We have to move away from government dependency to moving towards self-sufficiency, where our faith communities arise and begin to impact our society. So we have 1 minute left. I just want to say that the word shalom is very, very special to us at our church. And I want to wish all our viewers shalom, meaning health, wholeness, and healing for every area of your life. Thank you. Back to you, Linda.
Okay. Well, once again, we've concluded another edition of Your Health, Your Choice. We've been looking at blood pressure, diagnosis, effects, all the organs that are affected by high blood pressure. And as we close, I'd just like to leave this last thought with you. Somebody sent this to me on WhatsApp recently. Your smile is your logo, your personality is your business card, and how you leave others feeling after an experience with you, it becomes your trademark. So have a healthy and healthy week ahead. Your Health, Your Choice returns in a fortnight's time. Thank you.